Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. Today I'm going to talk about lower blepharoplasty. This is the marcation that is advertising in Mayo Clinic 2021, and this is the technique that are performing all around the world, all plastic surgeons. And this technique consists in resection of the skin in the lower eyelid in this area to go through the orbicularis muscle and remove all these lower eyelid fat pads and different marcations. Here we can see the marcation of this technique, and as you can see, this little skin that is removed there, with this little skin that is removed there, it is impossible to rejuvenate the rest of the skin of the lower eyelid. Here we can see the skin resection and how they are going to look for the lower eyelid fat pad through the orbicularis. This is the orbicularis muscle. And this technique produces a damage of the orbicularis muscle. The orbicularis muscle have the function to close the eyes and protect the eye. When the time passes, the orbicularis muscle lose strongness and produce a natural version of the lower eyelid that we call senile ectropion. As you can see, if we perform the conventional lower eyelid surgery, we remove the skin, we damage the muscle, and in the future or at the moment we are going to produce lowering the tarsus, and you can see here a severe ectropion produced by a conventional resective surgery. Also this one, and you can see the scar. Another one taken from internet, and this patient came to my clinic from the United States because she saw my videos and come to improve this incision. And the less important is this scar. The most important is the tarsus must be here to protect the eye, but now it's here, and the eyes and the conjunctiva is exposed to the wind and the dust, everything. Here is immediately into the operatory room, and we can see severe ectropion for this technique. And also this technique, like you can see here, the lowering the ectropion for a conventional blepharoplasty, but also the conventional blepharoplasty lack the ability to improve the periorbital skin. I think it is impossible to rejuvenate a face, a periorbital skin, if we do not use carbon dioxide laser. Maybe another technology in the future, but now the most important and most effective technique is through the energy of carbon dioxide laser. The carbon dioxide laser removes the outer skin, but also produce skin rejuvenation through the stimulation of the collagen, and it's long to explain, but it's rejuvenation. And I'm talking about to protect the skin and rejuvenate the skin instead of damage the skin and also damage the muscle. From 1984, I developed a technique using carbon dioxide laser. I published in many articles around the world. I have the recognition of the most important society of aesthetic and reconstructive surgery around the world, but also I have recognition in the Google because in Wikipedia appear this technique Spanish, and I developed a small incision in the conjunctiva, and through this small incision I remove the lower eyelid fat part without damage nothing. I don't put stitches, and the conjunctiva close alone because the lower eyelid fat part and just immediately down the conjunctiva. We cut the conjunctiva, I remove the fat part, and the conjunctiva close alone without stitches. This is very minimal invasive procedure. I use this technology. I tighten and improve the skin with carbon dioxide laser. I use less or more energy depend on the photoaging of each patient. I adequate the energy depend on the photoaging and the wrinkles. Here you can see my technique: a small incision, no scar down, and this picture was taken from internet. United States was advertised as the most advanced technique for eyelid rejuvenation using laser, carbon dioxide laser. But the surgeon used in a mode of cutting, and this is the same or including worse than using a scalpel. And with the laser cut and remove the skin and produce all these stitches, and you can see it's the same or worse. And this is what I'm doing is periorbital rejuvenation, but not only periorbital. We rejuvenate the skin of the nose and the rest of the skin of the face in the same procedure. If I told you I'm going to improve all this performing an incision here, what do you think? It is possible? Completely impossible. If I'm going to improve this removing skin, no, it is impossible. The only possibility is tightening and rejuvenating until now with carbon dioxide laser. Now I'm using new technology, but until now it's in process of corroboration. Here you can see rejuvenation. Do you think removing the skin here I can tighten the skin? No possible. My technique, another results, no scars, the improvement in the way we treat the upper and lower eyelid. We improve not only aesthetically, we improve the way the patient look. You can see here a tired, sad, and old expression, but here you can see the opposite. You can see a vertical oval that is illness and horizontal oval that is youthness. Okay, that's all.